So hello, good morning everyone.
Good morning, sir.
Morning,
Okay.
sir.
Okay, I hope you can hear me for today. I don't have any PowerPoint. Okay, I'll just try to draw and explain whatever is possible here. Okay, we are going to learn about the vagus. Okay, the vagus nerve. The vagus nerve is the 10th cranial nerve, isn't it? Vagus is the 10th cranial nerve. It is having its meaning is vagus is, in other words, is a wandering nerve because it's having the largest distribution all out the body. Okay, it is having the largest distribution all throughout the body. What is the first cranial nerve? Yes, what is the first?
Olfactory nerve.
So, just we will write here. The first one is olfactory. Then the second one is optic. The third is starts from oculomotor. Then cochlear. Then trigeminal. Then abduction. Then facial. Eighth one vestibulocochlear. Then ninth glosso. 10th is the vagus. 11th is the accessory, and 12th is the, what is the 12th? 12th is the hypoglossal. Okay. Now so we will be discussing the vagus for today. Now each of these nerves, all of these nerves inside the brain, okay, if you see the brain, then along with the brain comes the other parts of the brain, comes the medulla. So here all these nerves are having certain areas from which their nerve cell bodies, okay, they are collection of nerve cell bodies, okay, and these collection of nerve cell bodies are termed as cranial nerve nucleus. Okay, you know there is a nerve cell body like that, isn't it? Then comes the axon, then comes the dendrite and all. Now these many nerve cell bodies together will form a cranial nerve nucleus. From there a nerve will descend down like that. Okay, so for vagus, the 10th cranial nerve, there are certain areas, so it is a mixed nerve. The vagus is a mixed nerve. That means it is having motor as well as sensory part. Okay, so it's having both the parts. It's not only sensory, it's also motor. Okay, plus one more thing from the autonomic nervous system, the vagus is parasympathetic. Okay, so it is also, the nerves also carry fibers for parasympathetic system. Okay, so it carries fibers for the motor system, it carries fibers for sensory system, it also carries fibers for parasympathetic system. Till now, is it clear?
Yes, sir.
Now you see, if I happen to draw a cranial cavity, okay, if you see the cranial cavity like this, okay, the cranial cavity having anterior cranial fossa, middle cranial fossa like that, okay, and this is the foramen magnum, suppose, okay. Now somewhere here lies a foramen in the posterior cranial fossa, okay, there is a foramen in the posterior, so this is the posterior cranial fossa. Okay, this part is the posterior cranial fossa. So somewhere here is a foramen which is known as the jugular foramen. Okay, now I'll just wipe up this part. So we are left with only the jugular foramen here. This is the foramen magnum from where from the foramen magnum. So just keep it here, the foramen magnum. Now what happens, suppose if this is the brain, okay, this is the brain stem. Now from the brain stem there is an area in the medulla which is known as the posterolateral fissure. Okay, posterolateral fissure. Let us just draw the jugular foramen a little down. So from the posterolateral fissure, the vagus nerve will be coming. Okay, there will be rootlets from here, from which the vagus nerve will be coming. Okay, the vagus nerve is coming like that. Okay, now in the foramen, which is known as the jugular foramen, which in the jugular foramen, this is suppose the jugular foramen, from there it will unite to form the nerve, the vagus nerve. Okay, so this is how it is escaping, it is coming from the medulla. Okay, brainstem has got midbrain, pons and medulla. Okay, so I'll just write this is the medulla, okay, oblongata of the brain. From there it comes out the vagus nerve, and there are rootlets from there. It combines in the jugular foramen on either side, and it forms the vagus nerve. Okay, so along with it will come the 9th and 11th also. The 9th is the glossopharyngeal and 11th is the accessory. So these two, okay, will also come. The other nerves are also there, 9th and the 11th. So 9th and 11th are escaping from the jugular foramen. Now here we will be talking about the vagus. So we are talking about the vagus nerve. Okay. Now you see in the jugular foramen here there is a swelling, okay, a ganglion, and this ganglion of the vagus nerve, okay, you know the jugular foramen by now, so I guess I will be just, so this ganglion which happens to be there in the jugular foramen is known as the superior ganglion of vagus. Okay, so it is given in the just below there is another ganglion of the vagus when it leaves the jugular foramen, and this is known as, one is superior, so the other one will be known as the inferior ganglion. Okay, now as I have told you, vagus consists of motor plus sensory plus parasympathetic component. Okay, now from there it will descend down, both side vagus it will descend down. Okay, now while this is descending both sided vagus, now it is not only descending alone, but it is descending along with some vessels. Okay, on either side it is descending along with some vessels. There is a little pixelation anyway. So medially there is one vessel, laterally there is one vessel, and the vagus lies posterolaterally in between them. So vagus lies somewhere here in between them. Okay, so vagus is lying in between them posterolaterally, covered in a sheet, okay, like that. It is covered in a sheet okay. So together you can see there are 1, 2, 3 structures on either side. Medially there is the vessel which is known as the internal carotid artery. This internal carotid artery is going up. So this is the internal carotid artery. It is going up and supplying the brain. Okay. And the vein which you are seeing is the internal jugular vein. So ICA stands for, you all know, but just internal carotid artery. Okay. IJV matlab internal jugular vein. Okay, till now these three structures, the vagus, this vein and the artery are covered by this sheath, and this sheath is known as the carotid sheath. This sheath is derived from the deep fascia of the neck, which is known as the cervical fascia. I think, no, it's not yet done. So we will see the cervical fascia in the successive classes. So we have seen till now comes out from the medulla. It gives the superior ganglion in the jugular foramen. Then it gives the inferior ganglion. Okay. Then it comes and it is covered in a sheath along with the two vessels. Okay, one vein and an artery, and this is known as the carotid sheath. Now this is where it will descend down. Okay, let me just draw a few things over here. You know this is the internal carotid artery. Now let us draw what are the structures here a little down. So somewhere here the thyroid cartilage will come. Okay, the trachea will start from here. These are the tracheal rings. They will start from down here. Okay? Posterior to it, let us just, you know these structures. So posterior to it will lie posterior and to the left. What tube will lie? This one is what tube? Come on, what is this? Students, what is this tube? I am drawing just posterior to the trachea. Esophagus.
Esophagus.
Esophagus. So esophagus will continue as the down. It will continue like this. Stomach, isn't it? Somewhere here is the diaphragm. Okay. So this part till this part, this is the neck, isn't it? Till this part, this is the thorax. Niche, this part, this is the abdomen, isn't it? Now let us just draw the other structures. So what I am drawing, this one, any idea? What can be this? Going back, what it can be? It's going back there, in front, arching in front of the trachea. So this is the trachea, isn't it? In front, this is the trachea. So it is arching in front of the trachea. What it can be? हाँ, क्या हो सकता है ये? हाँ? So what is this junction where it is bifurcating? Trachea. It is bifurcating it at which part? What is this junction? ये कौन सा part है? What is this junction where the trachea is bifurcating? At which level it will bifurcate? The trachea? Yes?
Between T4 and T5.
Between T4 and T5. Yes, but In cadavers, usually it is T4. Okay. So now here you can see I am drawing the internal carotids. Okay. So what is this vessel? What is this vessel? What is this vessel? So there are three branches coming up from there. So this is, ये क्या हो गया? This is, what is this? What is this? This is you see.
Left subclavian.
Huh? So see, I have all told you that, so this is the arch of aorta, isn't it? So this is the left subclavian artery. This is the common carotid artery. Now don't get confused here. Initially the carotid sheath was with the vagus, okay, was between the above, when it divides, this the common carotid artery will divide into internal and external carotid, isn't it? So the first it lies between the internal carotid and the internal jugular vein, then it lies between the common carotid and the internal jugular vein down. Okay, so these are the two common carotids. So this will be, what is this? Right subclavian artery. Okay, now what is this? This one? What is this one? On the right side, what is this one? This is
Brachiocephalic.
brachiocephalic trunk, isn't it? Brachiocephalic trunk. So this is, ये तो हाई सेकेंडरी का है, ये सब अभी समझाने से कैसे होगा? This is the left subclavian, this is common carotid, this is again brachiocephalic trunk dividing into common carotid and the right subclavian. Again, this will keep on dividing, going up. This will keep on going up. Okay, this will move up. One will be external. Okay, and internal will keep on going like that in the same sheet. Okay, internal will reach the CNS and it will divide and give so many branches over there. Okay, so these are the different arteries. Okay, so this is the trachea. Okay, right and left, यहाँ पे lung है. So till here is it okay? So I think you have no need to name this, you know all these, the subclavians, the carotids, okay, you know all this now. Even the classes for uh, the arches are finished. So by now you should be knowing all these structures as well as the nerves related to them. So here again coming back to the vagus, you see vagus on the left side, okay, left side in the from the neck when it is entering to the thorax, it is in between which arteries? Left subclavian and the common carotids. So it is entering the neck, okay, like that, between these two, okay, between these two. On the right side, you see it is first in between those two, then it is just lateral to the brachiocephalic trunk. Why? Because on the right side there is the brachiocephalic trunk, there is no brachiocephalic trunk here. Okay, the subclavian then divides. So the descent on the right and the left side is a little different. ठीक है? Okay. Now somewhere here, if I draw, I don't know whether you will be confused, I think. Anyway, so somewhere here is the manubrium. Wait, forget the. Somewhere here is the manubrium sterni, isn't it? यहाँ पे नीचे sternum आएगा. So if you remember one more vein we have been talking about, which is related to the manubrium sterni. Let us make it a little, okay. So there is another vein which is coming like that, okay, इसको थोड़ा सा डार्क करते हैं. Vein coming like that. ठीक है. Another vein from this side. This is a vein going like that and forming a bigger vein. What is this? Any idea? What is this I am drawing?
Left brachiocephalic
Very
vein.
good. This is the left brachiocephalic vein. This is the right brachiocephalic vein. And what is this? They are forming what together?
Superior vena cava.
Yeah, very nice. So they are forming the superior vena cava. So यहाँ का relation थोड़ा गड़बड़ हो गया नहीं
Superior vena cava.
हाँ, superior vena cava. So after that, okay, after that, the vagus nerve on the right side is related posteromedial to the right brachiocephalic vein and the superior vena cava. So this is how they will enter the thorax from the neck. So till here, is it clear? Till this part, is it clear? Yes?
Yes, sir.
Okay. Now, you see, once it enters, there are again, once it enters, there are again relations here. Here, it will be crossed by the phrenic nerve. Okay, here it will be crossed by the blue one, sorry, what is this, purple. So it will be crossed by the phrenic nerve. Okay, only on the left side. Okay, then the vagus nerve will travel down. It will travel down. If you see it from the lateral side, see, I have made so much gaps between because you have to understand, okay, the structures. But actually, while it is descending down here, it is descending on the lateral wall of the trachea. Okay, somewhere here is the trachea. Trachea is a little big, so it is descending on the lateral wall of the trachea. Okay, this side also it is descending on the lateral wall of the trachea. It is almost attached to it. You have to, when you dissect, I don't know when you are going to dissect, then you will see that it is attached, almost attached, plastered to the lateral wall of the trachea as it descends down. Okay, then it goes just posterior to the, what is this? To bronchus, isn't it? Or you can say the root of the lung. It will go posterior to it. Okay, now here it will form the pulmonary plexus along with the sympathetic nerves. Okay, it will form the pulmonary plexus and it will supply the lung. Okay, so somewhere here, okay, we will discuss the branches later. Now just let us just discuss what happens here. So we will just adjust over here. So you can see the domes due to the fundus, the left dome is little up, isn't it? Now again come to the vagus. Now on the right side and the left side. On the right side, the vagus will go posteriorly, give branches to the esophagus. Okay, esophageal branches. Okay, it goes down like that. Gives branches to the esophagus. Then, so wherever I am drawing the dot, 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 that means it is posterior. Okay, this is posterior. This part is posterior. So it is forming the posterior esophageal, okay, branch. It's giving the posterior esophageal branch. Then it is forming the posterior gastric branch. This is the posterior gastric branch, and one is the celiac branch. This is about the, here it will give the pulmonary branch. Now we will write all this. Now this is about the right vagus. The left vagus, it comes in front. Okay, here it is forming the anterior branch for the esophagus. It goes down along the lesser curvature, okay, to form the anterior gastric branch. Okay, Now from anterior gastric branch it will give a hepatic branch and a pyloric branch, and from there it will descend down. ठीक है, बाकी branch दे देगा. Okay, so the left one is entering through an area from where the esophagus escapes and forms the stomach in the diaphragm. So this level is at what level? Which vertebral level? This area? What vertebral level? ये कौन सा level में रहता है? This area? Yes. Which level? This is at T thoracic. कितना? This is at? हाँ? T12 से aorta निकलता है बेटा. ये है T10. Okay. The T10 level. ठीक है. So the left vagus is forming the anterior gastric branch. The right vagus is forming the posterior gastric branch. Okay, and this is how they will enter and they will give branches to the stomach. ठीक है, समझ में आया? Till here, is it okay? Or shall I need to
Yes,
repeat?
sir.
Shall I need to repeat anything here? Because now again we will be seeing the branches. We will be seeing the branches now. We will be naming the branches. So is it okay till here? Okay, now you will just see what are the branches which is given by the vagus. Okay, so let us just first we will just repeat. Coming up from the medulla oblongata posterolateral fissure, uniting to form the nerve, along with the 9th and 11th nerve, it passes through, what is this? Come on, tell me, fatapat, what is this? ये क्या है? क्या foramen? Jugular foramen. Okay, in the jugular foramen it gives the superior ganglion. Coming out from the jugular foramen it gives the inferior ganglion. Then it travels in the carotid sheath along with the internal jugular vein. First the internal carotid artery, then the common carotid artery. Then it descends between the subclavian and the common carotids on the right side. On the left side first is descending like that, but then again it comes to the, it descends posterior here, okay, to the subclavian vein. Then it comes in relation with the posteromedial part. I mean, it lies posteromedial to the brachiocephalic, the right one, and then the superior vena cava. Then it descends down to the thorax, posterior to the root of the lung. Okay, then again it comes down, the left one forms the right one forms the posterior gastric branch, the left one forms the anterior gastric branch, and they will see these branches. Okay, till now I think it's okay. Now here from the superior ganglion it gives, so this is more important for the PGs. Okay, you don't have to go in details for the UGs. If you can remember through this chart, it's enough. So it gives two branches, 1, 2, 1, 2. Okay, I'll just don't write the 2. In fact, I'll just draw an ear. This is ear, if you can. So this is the second branch. Okay. So the first branch from superior ganglion, where it is still lying in the junction of the head and neck, the first is meningeal branch. Okay, the first one is meningeal branch. The second is auricular branch. Okay, where it supplies and gives sensory supply to the tympanic membrane, posterior inferior part of the external acoustic meatus, many more other structures over here. Okay, so these are the two branches. From the inferior ganglion, 1, 2, 3. So I don't have space for this. So I'll just write inferior ganglion. From the inferior ganglion, again 1, 2, 3. Pharyngeal branch. Pharyngeal branch. Okay, superior So these all are branches which are given in the neck. Okay, and cardiac branch. These three, pharyngeal. So this should go like that in the medial side. Let us just remove it. Let us just draw it in the medial side. So see like that, pharyngeal, okay, cardiac and superior laryngeal branch. The superior laryngeal will go along with the superior laryngeal artery like that. Okay, the cardiac branch will go and join the deep plexus, deep cardiac plexus. Okay, except one from the left side which will go and join in the superficial cardiac plexus. Okay, so these are branches from the superior and the inferior ganglia. So these were the branches given from the in the neck. Then it descends down. See, it is descending down. Here, one interesting thing you must have been studied while it passes. Okay, sorry, while it passes near here. Okay, it gives a branch which ascends up like that. Okay, on the right side. It ascends up and gives a branch in the neck. Okay, within the neck on the right side. So this is the recurrent laryngeal nerve. Recurrent laryngeal nerve. Okay, so these superior ganglion, inferior superior ganglion, you can say is the junction. Okay, the head and neck. Inferior ganglion is in the neck, and within the neck, on the right side, apart from these branches, from the trunk, it is giving the right recurrent laryngeal nerve. This one, and it will be winding down and in front, coming up again in front, and it will ascend up. Okay, along this tracheoesophageal groove. ये थोड़ा problem हो गया यहाँ पे. This should be going in the tracheoesophageal groove a little. See, on this side and the same left side, there is no such branch. Okay, there is no such branch. Only the last branch was the cardiac branch. Okay, now here the recurrent laryngeal nerve will be given at this level. Okay, where there is a ligament known as the ligamentum arteriosum. यहाँ पे सपोज हम लोग ने एक लिगामेंट बना दिया, दिखाई नहीं दे रहा है, ligamentum arteriosum. So it will wind up to the left of the ligamentum arteriosum and it will move like that in the tracheoesophageal groove. Okay, so right side में इधर ही खत्म हो जाता है. फिर in the thorax the branches we will see. So from the trunk on the left side, in the left side, it is the left recurrent laryngeal nerve. यहाँ पे on the left side. Then commonly it will give the pulmonary branch. Okay, pulmonary branch यहाँ पे it will give pulmonary branch. Okay, to form the pulmonary plexus. Remember, it is posterior to the root. Then और क्या branch दिया यहाँ पे? ये सब क्या branch है? Esophageal branch. Esophageal branch. राइट वाला पोस्टीरियर चला गया, लेफ्ट वाला इंटीरियर आ गया. फोर्थ इज सम cardiac branches, okay, which will again give inputs for the deep cardiac plexus. ठीक है, so यहां तक हो गया thorax. अब it has reached the abdomen. So in the abdomen, the gastric branches. Okay, so right side, on the right side क्या दिया, right side से posterior gastric branch. One more, this one is the celiac branch. Okay, on the left side क्या दिया, ये वाला anterior. So these all happens because of the rotation of the gut. Okay, the the way it rotates, the right goes to the anterior, the left goes to the posterior. This one is hepatic, and lastly a pyloric branch. Okay, so I'll just point it here. This is the hepatic, this is the pyloric, and you know the gastric branches. This is the anterior gastric branch, and this one is the posterior gastric branch. This is the celiac branch. So this is how the vagus goes and gives the nerve supply. You see the vagus through through the auricular branch, it supplies here, gives the sensory supply to certain areas, okay, including the tympanic membrane and the external acoustic meatus. Through the inferior ganglion, the pharyngeal branches, it will supply the constrictor of the pharynx. Okay, it will also give supply to the some part of the soft plate, some muscles of the pharynx. Through the cardiac, it will reach the deep cardiac plexuses. Okay, this recurrent laryngeal nerve, they will be supplying the intrinsic muscle of the larynx, except some of them, except leucothyroids. Okay, also giving sensory supply below the vocal membranes, the vocal cords. Okay, pulmonary branch going to the lungs, esophageal branch like that, cardiac branch. Okay, now you see this is having a component of parasympathetic component. Okay, all the things which you do when you are sleeping, when you are not doing anything, when there is no excitation, that is the parasympathetic part. Okay, so what happens for the, see, these all are the visceras. These lung, heart, esophagus, stomach, these are all visceras. So it is mainly related to the autonomic nervous system, parasympathetic and the sympathetic system. So when you go for the lungs, so the stimulation of the vagus for the parasympathetic system will cause bronchoconstriction. It will increase the secretion, secretomotor, secretion of the all the glands present in the bronchus in the lungs, constriction of the bronchus. Okay, for the esophagus, it will increase the peristalsis. Now, when you are sleeping, you are digesting, so you need to increase the peristalsis for the esophageal branches. For the cardiac branches, it is decreasing the heart rate. Okay, it is decreasing the heart rate. Now, for the gastric, again, it is secretomotor. It is secretomotor increasing the peristalsis, but the pyloric branch is inhibiting the sphincter. So you see, when there is reflexes like the cough reflex, so it is vagus. Okay, through the pharyngeal branch. Okay, where there is reflex like the hunger. Okay, hunger, pain there is there. It is due to the vagus because it is increasing the secretion. Increasing secretion means it is increasing HCl, and more the HCl, more there is gastritis. Okay, there is hunger, there is gastritis. So, in recurrent cases of peptic ulcer where there is more HCl secretion, these branches, these gastric branches are stripped off. Okay, this is known as vagotomy operation. And one more thing, when there is the auricular branch, it is said that in children or even in some adults, if you stimulate this, the sides of your ear, you feel hunger. Okay, so that is the relation between the vagus and its gastric branch, the auricular branch and the gastric branch. Okay, so till here, I mean, for today, is it okay? You have understood how it appears, how it goes, how it gives the branches? Yes?
Yes, sir.
So, shall I need to repeat anything or shall I conclude? Is it okay? You have understood, or shall I need to repeat anything? Okay, is it okay? Okay, chalo. Thank you. Okay, bye bye. Thank you. I hope you have understood. I am just assuming. Thank you.
Bye bye, sir.